compared to non-Hispanic whites, racial and ethnic minority populations have much worse outcomes when it comes to cancer. And we see many of those same populations calling 211 for services. We looked at smoking, smoke-free policies in the home, need for mammogram, colonoscopy, and HPV vaccination, as well as Pap testing. And when we compared that to state and national levels of screening and prevention, we found that people who called 211 had greater needs. Traditional marketing tends to not be as effective with low-income populations. For instance, a recent study looked at smoking cessation and tobacco quit line media attempts to reach broad populations, and it was found to be less effective with low-income populations. The nice thing about 211 is that the underserved population is already calling 211 for help with basic needs and services. So in a sense, you have a captive audience that's already accessing the service, and you could use that system in order to deliver these messages in a more targeted and potentially more efficient way. Just in terms of the scope and the reach of 211, we estimated that we could reach millions of people who are in need of cancer prevention and control services each year by using 211, and that's an incredible public health impact. People seem to be very open to receiving health information and even questions about their health from 211. In our study, no fewer than a third of people who received referrals accepted those referrals, and as high as 70% of women who were eligible for mammography accepted the mammogram referral. And in previous research, we've seen that people believe that asking about health and getting health information actually enhances the 211 service.